Hello, and welcome back to T-Shirts and Tea Tuesdays, guys. It is that time again. And so we want to thank you tonight for tuning in to T-Shirts and Tea Tuesdays, guys. We hope that you have your teacups ready because we have some piping hot tea tonight. Now, let me tell you something. Tonight's episode might not get you all lit and on fire, but it's a good show. The reason why it's going to be important for us tonight to bring forth our guest and the topic of conversation, which is maternal mortality rates amongst Black women, being increasingly high, is because we're seeing a trend across the country. The United States is actually the worst country in terms of maternal mortality rates. We have the highest rates in the world. And with that being said, amongst Black women, we are 3 times more likely to die in childbirth versus our white counterparts, which equates to 243%. Okay, that's how much higher we're talking about in terms of statistics. So, with that being said, it's important that we touch on this conversation because last season, season 5, we stressed about the repair of the Black family and things that we can do mentally, emotionally to begin to repair our families and bridge those gaps. We have so many different obstacles in our way that are coming against the thriving of our women, of our community, of our families. And so now at the top of that list is the maternal mortality rates of our Black women, and not just the Black women, but we are facing high percentages of Black babies that die on an annual basis. So we want to really get down to the root of the cause and really find out what is causing these issues. And so we have some very good guests joining us this evening. We have nurse practitioner Jaida Herring that will be with us. Her name is Jaida Taylor-Herring, and Dr. Orizu that will be joining us as well. Dr. Orizu just came out of surgery, so she will be joining us a little bit later in the show. By the time we get started with our interview section, by that time, we hope that she'll be here, but she's coming. So she's made that commitment. We're excited to have them here because we really want to hear the experts speak on this topic. I mean, we've seen it in the news, we've seen it in the newspapers. And if you guys have not, it's time to really pay attention because one of these young women that passed could be a niece, a daughter, a cousin, a close friend's child. We want to make sure that we are informed with knowledge and information to help prepare our women on how to be ready and prepared to give birth. And we know that most of the pregnancy related deaths are preventable. They are preventable. And that is why we have our platform guests here tonight. So with all of that being said, this episode of T-Shirts and Tea Tuesdays is the last episode of the season. But don't be disappointed because throughout the next 2 months, we're going to have a lot of special guests coming on. We're going to have some special episodes. So you guys want to make sure that you like our platforms. You want to like T-Shirts and Tea Tuesdays, BIMP Corporation. You want to make sure that you like us on YouTube, Instagram, Facebook. Make sure that you like us and click the notification bell so that you get notified anytime that we go live because y'all don't want to miss the tea. This tantalizing, effervescent acumen that we be bringing forth every Tuesday, honey. So with that being said, again, like I said, make sure that you subscribe, that you're following us, that you're liking us, and that you're giving us some hearts over in the comment section, guys. We want to hear from you. Make sure that you are putting your comments out there. Come armed with all of your questions that you want to ask our guests tonight. Make sure that you guys are sharing, share, because on T-shirts and Tea Tuesdays, honey, we say that sharing is what? That's right, caring. Yes. Okay. So, with all of that being said, and we've gotten some of the formalities out of the way, I want to always, as always, thank our producer for doing a fantastic show this season with all of our, graphics, marketing materials, promotional materials. He is on it. And let me tell you something, he keeps us looking good over here at T-Shirts and Tea Tuesdays, and not just T-Shirts and Tea Tuesdays, but Bimp on the Spot with Taz as well. There's a lot of work that goes into making sure that this show is presentable, that it's professional, that it's classy, and that everything that we put out represents Black excellence. So guys, give a round of hand of applause for our producer. Yay. And not only that, but I'd like to thank my makeup artist, Miss Tyra Renee, for always doing a fantastic job of keeping my makeup up and, just having me looking fabulous, honey, because I can't come over here looking anything less than beautiful, honey. So with that being said, if you want to use Tyra Renee's services, make sure you hit her up on Instagram at Makeup by Tyra Renee. With that being said, it's time to get down with the nitty gritty, guys. If y'all missed last week's episode of T-Shirts and Tea Tuesdays, guys, y'all missed a treat. But just because we like y'all or whatever, we're going to go ahead and play a real quick throwback from last week's episode. Stay tuned. We'll be right back.
Because one thing we believe is we want to create an environment, a platform for local businesses on the continent to have access to the global market. They may be seeking investors, but we just want to create that avenue, that place where both parties can shake hands.
Yeah.
We'll continue to bring products because we understand, something that is new, people can be a little skeptical where there's a lot of risk. We want to take on the risk. We would take on the risk to start with. We would do this to make you comfortable.
Yeah.
And if there is any issue along the line, we can walk you through, we can help smoothing all the rough edges. But ultimately, we would, just like what you're doing, LaShawn, we would like you to create your own brand, source product from the motherland, directly from the source.
Yes.
So we did this to let you know the art of the possible. It is possible. We're here to walk with you. It's the beginning of many great things. Many, many great things. The world is waiting for us to step up, and as we're stepping up, we have superior products. I mean, I'm not trying to brag on our products, but I'm just saying it is superior.
Literally, I'm telling y'all, it is. Okay, so that was our interview with My Sahara tea owners, Mr. Adaume and Tama. They are just two of the co-owners of My Sahara Tea. So, guys, listen, I wasn't playing about that tea. I got it right here in my cup. Sahara tea, guys. If you are interested in purchasing this tea, which has so many great medicinal properties to benefit our bodies and health, please make sure that you go over to their website and purchase you some. Try it. It's bysahara.com, www.bysahara.com. So listen, now that we have gotten all of that out of the way for last week's show, I want to encourage you to tune in this coming Thursday, July 28, 2022 at 7:30 p.m. to Built on the Spot with Taz, special guest of Q&E podcast, Quincy Hicks and Edgar Martin Jr. That is going to be a pretty amazing interview. Guys, join us. Tune in on Thursday at 7:30 p.m. to hear about that. So without further ado, it is time to go ahead and get y'all teacups out. Because this is going to be a pretty serious conversation, very informative conversation, but one that needs to be had in our community. Each year in the United States, about 700 people die during pregnancy or in the year after. Another 50,000 people each year have unexpected outcomes of labor and delivery with serious short or long term health consequences. So, we circulated a video about a few days ago that gave some interesting statistics about the maternal mortality rates for women. But at the top of that list are Black women who are dying at 443% higher rates than that of their white counterparts. And we're not even consider, I mean, that within that whole number, you're looking at the nationality of many different Asians, Hispanics, whites, Blacks. But at the top of that list, our women are dying at a higher rate. And so because of that, we wanted to make sure that we brought this topic to our platform. No, it's not about business, but it is about repairing our families and our community. It's about saving lives. And so it's important that we dive into this conversation and really find out what's going on. And so in order to do that, we have with us tonight, as I announced at the beginning of the show, we have nurse practitioner Ms. Jaida Taylor-Herring. And then we have Dr. Ify Orizu, and she's here tonight. She's going to give us some great information. Both of them, I know that they're in, and I know Jaida personally. She has many years in this industry, has seen a whole lot, and so that is why I wanted to bring her here. So make sure you guys have your pad and pens ready. This is one of those shows where we need to be taking notes, because you never know when this particular situation might knock on your own front door, and we need to be ready, armed, and prepared with the knowledge that we can use to help counteract these high rates. So with that being said, we have a quick clip, and we'll be right back right after this.
We talk a lot on this show about racial health disparities, and one of the most glaring and heartbreaking examples is maternal mortality. The U.S. already has the highest rate of any developed nation of people dying from complications of pregnancy and childbirth. But it is worse for people, especially Black Americans, whose maternal mortality rate is 3 times higher than that of white Americans. 3 times. And it's actually getting worse, not better. From 2018 through 2020, the first year of the pandemic, maternal mortality rose for all groups, but for Black people, it shot up by 25%.
That Black women in America are 3 times more likely to die giving birth in America than their white counterparts. And Zerlina, we cannot ever get used to that statistic. That statistic is 243% more likely to die giving birth in America than their white counterparts. And pre-pandemic, there were some really racist explanations for this, like the Black women are less educated or they're welfare queens. But now we know studies show that a college-educated Black woman is still 5 times more likely to die giving birth than their white counterparts. So we know, the pandemic has really just exposed how it's racism and not race that is driving these disparities.
It's such an important point. I think about Serena Williams when you say that, right? Serena Williams almost died giving birth to her child, and it was because they didn't believe she was in as much pain and distress as she said, and that is a common experience borne out by the data. Dr. Marsh, why are Black people 3 times more likely to die? Why is this a data point, and why does this trend appear to be getting worse instead of better?
I think preeclampsia, which is a complex condition that involves high blood pressure and changes in blood flow to the uterus and to the pregnancy, is a significant contributor. Blood clots are a significant contributor that develop that all women are at an increased risk for during pregnancy. But I think the challenge is when you report the symptoms, are you asked about the symptoms? When you do report symptoms, are you taken seriously? Are you believed? Are you followed up? How are you treated? And who is the health system really created for? And so that's where racism comes into play. It's not about biological differences in as much as it's about, does my caretaker provide listen to me? Do they value my life as much as other patients? And do they value my voice as much as other patients?
Yes. Welcome, ladies, to the TeeShirtz NT Tuesdays platform. I really want to thank you for taking the time out of your busy schedules to join me tonight for this segment to talk about maternal mortality rates. I'm so excited to have you all present. I believe that this is a conversation that we must have within our own community. Sometimes when we see stuff like, news or media clips like this, it's often we feel disconnected from it, right? Unless it's a situation happening at our own front door or that we know somebody personally who has experienced this, we are kind of disconnected. We don't really process it the way that we should. And so I felt like because it's something that's major that's happening now within our own community, and as I said before, a lot of the maternal mortality rates, we can decrease those if we, with knowledge, education, understanding, knowing how to ask the right questions, choosing the correct care providers, OBGYNs, things of that nature. I believe that we can begin to counteract some of these rates. But before we get into the good tea about this and educating ourselves and arming ourselves with the knowledge, I want to give you all the opportunity to tell the people who you are and what you do. Okay, so let's get started with that. Dr. Orizu, can you share with the people who you are, what you do, where you're from, how you got into the industry, all of that good stuff?
Absolutely. Thank you guys so much for having me. It's such a pleasure. Like you said, my name is Dr. Ify Orizu. I am currently a fourth year OBGYN resident at Bayfront Health St. Petersburg, and I'm also the administrative chief of my class. I'm in my last year of training for OBGYN, and by this time next year, I'll be practicing on my own. So
congratulations. That is so awesome. All right, y'all take her name down because she'll be so y'all need to make sure you got a good OBGYN.
Yes, for sure. I was born and raised in Atlanta, Georgia. My parents immigrated from Nigeria, so I'm first generation Nigerian. I'm one of four children. I'm the oldest, and I knew since the tender age of 11 that I wanted to be an OBGYN. I delivered my first baby when I was in high school, and at 18, I was in this program. And just right then and there, I knew like this is what I wanted to do the rest of my life. Like I wanted to bring children into this world. So I kept at it, and by God's grace, I've gotten this far. So
that is so amazing. That's awesome. Oh my gosh, 18, you delivered a baby?
yes.
That is so interesting. And it's also really awesome too that you knew what you wanted to be at 11 and you kind of just stuck with it. Because I know my career path has changed like a million different times,
Right.
Just all over the place. But I think that it's really awesome that you are, you've endeavored to stay, to stick and stay. And now you're seeing the fruit of your labor, getting a chance to experience, all that that is in the industry.
Yeah.
And so that's really exciting. I can't wait to speak with you about that. Thank you so much for joining us this evening. Okay, so Jaida, I know you. But the people don't know you. So please share with the people who you are, what you do, how long you've been in the industry, all of that good stuff. Oh, we can't hear you. Hold on one second. Hold on. Okay, go
Yeah,
ahead.
I think I'm unmuted. Okay, first, let me give a big shout out to Dr. Orizu and a thank you. She just got out of surgery and ran
Yes,
home to do this because I
yes,
asked
you
her, when you
did.
called me, I called her and said, please, will you be on this with me to help? Because she's actually doing some research in this. So she didn't want to toot her own horn, but I'm going to toot it for her because, and I'm so excited and proud of her for
Yes,
what she is doing. So I just want to tell her first, thank you so much for being on here with me because it's not an easy task to be able to jump out of surgery, run, and it's storming here. So
yeah,
she ran home and was able to jump on. So thank you, baby. I appreciate it.
yes. Thank you so much. Yes.
But my name is Jaida Taylor-Herring. I'm originally from Fort Myers, Florida, where I was born and raised. I went to Bethune-Cookman College for undergraduate and then worked in community health for a little while and then labor and delivery. And the opportunity came for me to go back to school. And I went to University of Florida. But it's funny that she said she knew since she was age 11, because I was about 11. I was in 6th grade when I knew that I wanted to deliver babies. And this is something that hits me very differently because I didn't have, as a little Black girl, I didn't have the encouragement, of course, from my parents and maybe people in church. There were no doctors that looked like me, not that I had ever seen. So not even midwives. You would have, teachers, nurses, things like that. And so that's what I was encouraged. I knew I wanted to deliver babies, though, not just be there. I wanted to deliver babies. So when the opportunity arose for me to be able to do that, then I went to University of Florida and got my master's and my training in midwifery. Yeah, I have 5 children. Lord, I won't even give you the ages, but we got a bunch of them around here. One granddaughter, and I'm as happy as can be. I think I have been in this arena for almost 20 years.
Yeah.
Almost
Literally.
where we met. That's
Yeah, I think it should be longer than that, Jaida, because
I was pregnant with Jordan. She's 19.
Yeah, that's true.
And
Yeah.
I started maybe a year before that. So
20.
about 20 years. Mm-hmm.
Yeah.
Yeah,
Wow.
we definitely see our good days and our bad days in this field. The majority, because people always say, "Oh, you work on the happy floor," and I can say the majority, we have a lot of good days. But when things go wrong on labor and delivery, they go tragically wrong.
Yeah.
And that's the part that you don't ever want to see.
Yeah, and that's something that I actually, somebody else just said that when I was reading up and doing some research, and the author of the article that I was reading from the CDC basically said the same thing. When something goes wrong, it goes tragically wrong. It's not like a simple, it's a lot of times it's major. And so I can remember growing up as a child, hearing my grandmother and them talk with friends and stuff, and one of the things they used to say was, childbirth is like the closest thing to death.
Oh, I was going to say that. Yes.
For a woman than anything else. And I could not understand what that meant back then. And even when I became an adult and got pregnant, and because my pregnancies outside of having morning sickness was so easy, you know what I'm saying? It was a disconnect for me. I really didn't really understand that, but now I'm really, when I began to see videos about it, YouTube videos, vloggers talking about it, seeing it in the news, I'm like, wow, for it to be an issue, when you see it on major media outlets, then it's a major problem, right? And so seeing it like frequently, I'm like, whoa, this is a conversation that we need to be having with our community, within our own community. I can remember, I think the one thing that really brought it to light was Judge Glenda Hatchett's son. That case of her daughter-in-law, that was a situation that could have definitely been prevented had the doctors listened to her when she was saying that she was feeling bad, something was wrong, and then they waited until the last minute to try to go in and find out, and now it's too late. She pretty much lost her life from bleeding out. And so these are some of the things that I believe that they're talking about when they talk about racial disparities that exist amongst our people, right?
Mm-hmm.
Can y'all just give us a little information about what you're seeing and what you're finding, and maybe what are some of the issues that aren't being addressed in the medical community as it pertains to Black women in pregnancy?
I'll say first, and then I'll let Dr. Orizu go, that the light is just being shed on it at this point, or I guess turned on brighter, but this has been going on for a very long time. I remember back in college watching something on, I think it was Ricky Lake. You know how long ago that was. You probably don't even know who Ricky Lake is. Yes. So, and it was talking about disparities and the rate that Black women died and trying to figure out why. And it's called Being Black in America.
Wow.
And that was basically at that time that was the only thing that they could get to, because like the young lady said in the clip that you showed before, people like to put it on being unhealthy or being on welfare or not getting the right care. But they compared college educated Black women to white women that hadn't even graduated high school.
Right.
And the rates were still higher.
Wow.
Yeah, so we are just now and I think it has a lot to do with, we have more Black physicians, more Black nurses, more people looking into this, and more researchers and understanding that this is a problem. This is a huge problem.
Wow. This is intense. Like, I didn't even realize, it's almost like with everything that's going on with the racial, crimes that are happening against Black people. A lot of this, like we said, these things have been going on for years. It's just now that people have smartphones and they can record and go live. And so it's more revealed and exposed than it was before. We didn't have these, this technology at our dispense back then. So now it seems as though this is something new when it's really been happening the whole time. Wow.
Yep.
Yeah. And I would totally agree. Like Jaida said, this has been going on for decades. It's just very similar to how people are so shocked that we're finally seeing police kill Black people on camera just because it's being recorded. But this has been happening for decades, and people have been hushing and sweeping it under the rug. So, being Black in America is a statistic on its own, unfortunately. And, for me and Jaida, we see it every day in the faces of our patients. And sometimes we have good outcomes, sometimes we have bad outcomes. But luckily for us, we try our best to mitigate those poor outcomes because, like you said, like you mentioned earlier, when things go bad, they go bad very quickly. And I pride myself, and thank God for Jaida too, that we as Black women have taken an interest in taking care of women, because especially women of color, it's so, you don't know how many times I've walked in a room and they're like, oh my God, you're the doctor. I'm so happy to see someone that looks like me. And they automatically are more trusting. They're automatically more willing to listen. And, it's so easy to say, oh, the patient's non-compliant, they don't care about their health. But like, sometimes they just need someone who actually looks like them to explain it and break it down, is willing to listen to them and is willing to like actually say things in layman's terms, not use all these big scientific words.
Right.
I love taking my time with my patients. I like to draw pictures. I'm a visual person. So I'll explain, this is what's happening to your baby, or this is what's happening to your uterus, your cervix, whatever. And I break it down for them. They're like, wow, like no one has broken it down for me like that. Like I really understand what's going on. And if it's severe, they understand the severity of the situation. So they know, like, look, I'm not playing around with you. Like us Black people, like I'm looking out for you, and you need to take this seriously, because I'm taking you and your baby seriously.
Wow.
So, and like you mentioned earlier, Black women are 3 to 4 times more likely to have obstetrical emergencies or die from obstetrical causes compared to their counterparts, which are white women. And interestingly enough, like, like Ms. Jaida mentioned, I am doing research on this. I will be presenting my research in Orlando in a couple weeks. I'll also be presenting my research in Charleston. So I'm pretty excited. But, after doing a lot of research, I learned that even in Florida alone, 14% of maternal deaths were Black women. 14%. That's a large number.
That's huge.
And then it was Black women, and then another 14% were Hispanic women, which I mean, they're very similar to us when it comes to comorbidity.
Exactly, yeah.
Because they're marginalized just like we are. So it was very astonishing to see how much Black women are kind of like pushed off to the side and disregarded. And, you know, in my research, luckily, I didn't find, because what I basically looked at was, do Black women have a higher risk of worser outcomes when it comes to having hypertension for their babies and themselves? So what do worser outcomes look like? When you have hypertension, you have an increased risk of cardiovascular disease as a complication. And for babies, they're more likely to be growth restricted, so they come out really small. And they end up being in the NICU, requiring ventilation, things like that. So I wanted to look at if Black women have a higher risk than white women who have hypertensive disorders. And after doing all my research, I was happy to see it. I was a little shocked, but Black women and white women, at least at our hospital, were pretty par for par. There weren't that many differences. There's only a small difference in who needed more IV medications than the other. And IV medications are only given when your blood pressures are so severe that we can't bring them down, meaning it's almost going to be an emergency. So Black women stood out that they needed more IV medications than white women. But then that also told me that their hypertension was less controlled. But then that also told me that they don't really know what's going on with their hypertension. They're not taking their meds. Maybe they can't afford their meds. They're not coming to clinic to make sure that their blood pressures are getting checked. So, you know, I still feel like there's a disparity, although my research didn't show that, just because, you know, I only looked at our hospital. But I'm sure if we did a multi-center research, it would show across the board that there is a huge disparity between Black and white women, especially when it comes to hypertensive disorders.
Wow. So talking about hyperintensive disorders, is it generally that Black women develop hypertension during pregnancy, or is it like a diagnosis that maybe they didn't know they should have received for hypertension? Is it developed during pregnancy, or is it pre-pregnancy hypertension?
It can be both.
Yeah, go ahead.
It can be both. But what I do tell Black women that don't have a history of it, especially being Black is one thing that definitely puts you at risk. But my young women, I tell them, if you have these three, you have the trifecta. So you have to be very careful. If you're young, Black, and it's your first child, you are definitely at greater risk for high blood pressure than anyone else.
Wow.
I totally agree. I just had a young woman last week. She came in and she was in her third trimester. She had preeclampsia. She needed to be delivered. And she's like, I've never had blood pressure problems. She was broken down in tears, so distraught. Like, how could I have blood pressure in pregnancy? And I said, number one, it's because you're Black. Number two, like Miss Jaida said, you're young and it's your first kid. And it always happens in the third trimester. I always tell my patients, like, it'll sneak up on you. Your whole pregnancy will be fine. You're coasting. Everything's good. And then boom, you're 36 weeks, blood pressure issues out of nowhere.
Right. And which in turn can be very scary because everything has been going so well that you just think, oh, I'm just not feeling good today, when you really not feeling good for a huge reason.
Exactly.
So are there any preventative measures that can be taken by the mothers during pregnancy that can kind of prevent that? Has there been any research done to indicate whether or not that's something that's preventable?
So it really depends on your history. If you've had a history of preeclampsia, then yes, definitely we recommend taking baby aspirin at night. If you have a history of chronic hypertension, meaning you have hypertension outside of pregnancy, or you were diagnosed before 20 weeks gestation, then you have an increased risk of developing preeclampsia. So there's like different risk factors where you could be put into a pool of, yes, this person meets criteria to be started on baby aspirin. And baby aspirin has been proven to show that it can help decrease risks. However, it's not 100%. Nothing's not 100%. But the way baby aspirin works, it's a blood thinner, essentially. And with and how preeclampsia works, I mean, it's very multifactorial. There's no one etiology as to what causes pre-E, and it's still sometimes up in the air, but it has been shown that there might be some kind of like clotting factors that might be involved with the placenta. So by giving baby aspirin and thinning out that blood that goes between mom and the placenta, the hope is that it decreases their risk of developing preeclampsia. And I've seen it how I feel like for some of my patients it helps, and then there are some that, you know, they've been on baby aspirin religiously and they still end up developing preeclampsia, or they get severe features and they need to be delivered immediately. So
the other thing is the basic stuff that they can start with is, number one, coming for your prenatal visits. That's going to help, because we can see signs of things that you wouldn't see at home, like spilling protein in your urine and things of that nature. We're taking your blood pressure, so we know. The other thing is your eating habits, dieting and eating like you're supposed to. But like she said, if you have a history of these things, then there's not much that we can change while in it. But leading up to, you have to make sure your lifestyle is better.
Wow.
And I agree with the prenatal visits, because the more you're more compliant with your prenatal visits, you know, we ask those questions. Are you having swelling? Are you having headaches, blurry vision, chest pain? Those could be signs that you are developing preeclampsia or some sort of hypertensive disorder. And some people say, oh, I'm just short of breath. Like, it's just because I'm pregnant. And little do you know, like, you're developing preeclampsia. So it's like, well, how bad has your shortness of breath been? Has it been worse than normal? So the more you follow up with your doctor, the better. And, you know, don't be afraid to tell your doctor, this is what I'm feeling. You know, even if they brush it off, keep telling them, no, like, I'm not feeling right. Something doesn't feel right. This is abnormal for me, and I need you to look into this.
Yeah.
Wow. So that brings me into like actually two questions. So the first question is for Jaida. Jaida, have you seen an increased rate of hypertension amongst pregnant women over the last 20 years, or is it kind of sort of the same? Because I'm trying to wonder about if maybe some of it is environmental, then the things that, because, you know, there are a lot of GMOs in our food and stuff like there are so many different things that affect our environment around us. So I'm just, you know, in my mind, I'm thinking about research and like, okay, are these numbers higher now around this time? And then what would drive those numbers higher over that 20-year period of time that you've been in the industry?
I would say mine has gone up because I worked at a low risk clinic before, and now we work at a high risk clinic. So of course, we're going to see more of those kind of problems. Gotcha. And then we deal with really young patients, really old patients, and now you have a lot of women that are, I guess how they put it, they have gone and filled their career, and now they want to have babies. And they're 46, 47, 40.
Got you.
Those things can put a little wear and tear on your body.
Right.
And, but so, yeah, I think it has increased. It definitely has not decreased. I have not seen a decrease at all.
Got you. And then the other question that I was going to ask is, do you all get any type of kickback from other medical professionals? Like, you know, if you're questioning something about a patient and you believe strongly that this patient needs a certain type of care because they are Black patients, right? And you're paying attention to some of the signs, do you ever feel like you're getting kickback or resistance from other medical professionals who are not Black? Because I heard something like, and I actually read this too, where a lot of white doctors think that Black women are just actually stronger, or Black people are stronger
We deal with pain better.
Right, in terms of pain, and we can endure a lot more, and, you know, things of that nature. Have you all seen any of that in your industry? Not necessarily maybe with the people that you work with, but have you experienced that at all, where you've seen another doctor not maybe take a patient very seriously?
Absolutely. I have.
Okay.
I've had patients who are transferred to our hospital from other neighboring hospitals because, you know, they're just like, oh, we don't know what's wrong with this patient. Like, we think it's this, we think it's that. And by the time they get to us, I'm like, she has preeclampsia, and you should have started her on this medication. And I don't understand why you guys didn't do this. Like, obviously I'm saying this to myself. I don't talk to those providers
Right.
face to face over the phone, but I'm just like, why was this mismanaged? And why was this patient not taken seriously? Because it's so easy. Because, when you're pregnant, a lot of patients, like, I always call them like the pregnancy wells for the patients. They're like, oh, doctor, I'm feeling achy. I'm feeling this, I'm feeling that. So it's so easy to kind of like brush them off like, oh, you're just pregnant. Like, that's what's going on. But again, like Jaida said, when you don't feel right and you're like, no, this is different, you have to take that seriously.
Yeah.
And I even had that with a patient 2 weeks ago. She flew in just for her baby shower. And lo and behold, she was at Publix shopping and was like, I don't feel right. Something like I feel weird and I feel woozy and I have a headache. So she took her blood pressure at Publix and it was 200 over 100.
Wow.
So immediately she came to the nearest hospital, which was Bayfront. Never seen this patient before. We weren't taking care of, like I said, she was getting all her prenatal care in North Carolina. And we ended up delivering her the next day because she had severe preeclampsia, swollen like the Michelin Man. It was bad.
Gosh.
And it was bad. And I was like, and if she didn't take herself seriously, if she didn't say, oh, no, then something bad could have really happened because it's not like you can seize, you can have a heart attack, you can have a stroke. Those are very serious complications. So I always told her to, like, I just saw her last week for her post-op visit. I was like, I'm so happy you knew to come into the hospital. You knew something was wrong and take your blood pressure. And she had no problems this entire pregnancy. Literally was like 34, 35 weeks pregnant, just shopping in Publix and said, something doesn't feel right. I'm going to take my blood pressure 200 over 100, So, I'm grateful to God that she had that premonition.
Yeah. To the hospital.
Mm-hmm.
Oh my goodness. This is like really good information. And it really is like an expression to women to say, trust your instincts.
Yeah.
Do you feel like something's not right? Then 9 times out of 10, something's not right. And it's better to be safe than sorry, right? When you feel like something is off, get your butt to all they can say is, hey, ain't nothing wrong with you.
Right.
Versus, not following through on your intuition and then something tragic happens. And, if you lose a child, you're never gonna, probably not forgive yourself for it, right? Or it could be your life that's in jeopardy.
Right.
You know what I'm saying?
Lose your life and not be here with you.
Exactly. What are some of the other issues that you find amongst Black women that aren't necessarily addressed? So we talked about hypertension. I know that some women have gestational diabetes and things like that. Can you talk about maybe some of the other triggers that could cause death rates amongst Black women?
Those are two of the big factors there that you just named. And I teach patients that all the time. High blood pressure and diabetes are the two things that affect Black people the most. And these are two diseases that we can turn around very easily by changing your lifestyle as far as eating habits, exercising. But, we all know that stuff is not the easiest. We preach about nutrition all the time, but it is extremely expensive to eat properly.
Yeah.
It can be, and we have to look at that with our patients. Some of our patients sometimes, is it easier for her and her 4 kids to go buy $5 checker burgers or try and buy a salad? So we have to think about things like that. But I teach them that, and I tell them also, those are two things you can change. But once it starts to interfere with your organs, that stuff you can't turn around. So you're talking about your heart, your kidneys, your brain, your liver. When those things start to get affected by your blood pressure and your diabetes, you can't turn that around. So you start early. The other thing I try and teach them during when we talk about diabetes is this puts you at greater risk for diabetes outside of pregnancy later in life. So yes, gestational diabetes is something that you get during pregnancy and it goes away once you have a baby. But it does put you at risk for a higher chance of getting it later in life. So starting to change your eating habits and exercising and doing things will help with that as well.
Wow.
But there are lists, and I can't even list of things that put you at risk from anything.
Yeah,
diabetes, high
blood pressure, history of blood clots. You know, if you've had a history of a blood clot in your leg, in your lung, that puts you at high risk of everything. So it's very important. You know, it all starts from the beginning. Like going to the doctor regularly, getting your annual checkup, making sure you're getting your labs, whether you're pregnant or not.
Preventative
care. You know, get your mammograms, get your pap smears, because everything can be prevented. You don't want it to be where it's like, oh, I haven't seen a doctor in 20 years. And by the time you come to see me, you already at stage 4 cancer.
Right. Wow. See, that's a good example, because as Black people, we have this thing about going to the hospitals, and if he wouldn't have gone to the hospital or she wouldn't have gone, she would still be alive today. Well, she hadn't been in 20 years. Just went today, and so she just got this information. She probably had whatever it is we told her 15 years ago.
Yeah.
So that's and I understand rightfully why we as Black people have a hard time trusting the medical system. But I also know that there are more people out there that look like me and that look like Dr. Orizu, that are in it for the right thing and that are trying to educate our people and change this mindset that we have.
Yeah. Absolutely. Oh my goodness. Well, one of our viewers said, how important is it to have a midwife?
Very important.
So let me say this, because a lot of people get it, I wouldn't say confused. When they think midwife, they think of like back in the day that maybe our grandmothers or great grandmothers, you had somebody that came to the home and delivered babies like that. That's not the kind of midwife. There are still some midwives there that do that or deliver in birthing centers, but most master's prepared midwives deliver in hospitals. So we see you in the offices and do deliveries just like you would if you came to see your OB. So that's the difference. The difference is we normally see low to mid-risk patients. We don't do surgeries. And we have someone like Dr. Orizu that we consult with or transfer our patients to if it becomes something out of our scope. So it's extremely important to see a midwife or an OBGYN, someone that is taking care of you for your obstetrical or your women's health care. It doesn't just have to be for OB.
Right. Gotcha. One of the things that I did want to say is this, and I wanted to kind of talk about some of the racial disparities that you all see in the industry. But before I say that, I will say, because I have 5 children too, you know that, Jaida. My last 2 are twins. And after my first child, I wanted to see midwives because I felt there was such a disconnect between myself and the doctors. And back then, most of the OBGYNs were male doctors. So when I had my second child, at that time, that's when you really start to see a movement, a transition of midwives coming in to kind of be that in-between person between you and the doctor. And so my experience with my midwife was just so wonderful. I was just like, man, I can ask any question. I feel like, because she's a woman, she can kind of relate. And so it was more of a connected type of relationship. And so I believe that is important. What do you all think about not just only the midwife, but doulas? What are your thoughts about doulas as well?
I think doulas, honestly, personally speaking, I honestly don't know much about what their role is in terms of the care for the mother. I know we've had several patients who ended up in our hospital just because of like an obstetrical emergency, who they brought their doulas, and I saw them more as like of a support system. But I really don't know what their role entails, because I think sometimes I get them confused with a midwife. And so I will let Miss Jaida kind of touch on that, because I never really understood their role.
So you were right. A doula is more of a coach. More of a support system person, more of a coach. They're there to kind of talk with them through breathing. I have had, when I was delivering, I had a few patients that would come with their doula. Now, usually when you have a midwife, 9 times out of 10, your midwife is kind of your doula. We do supporting and coaching and all that, but I didn't care if they had a doula. That was fine. It was a lady named Miss Betty that worked around here. She was the doula for everybody that I had that came through the office that I was working in. So she had a really good system set up with them. For some of her patients that needed rides, she would pick them up, but she would meet them in the office. She would be there with them through their visits. But it is more of a coach, more of a support person. They don't really do the medical part at all. But she would be in there. She would change their pads underneath them. Help. She was more of a help to the nurses a lot of times, but she wasn't one that kind of got in the way. Sometimes people get confused, and I think this is where the shade or the shadow comes with doulas. You have great doulas, and most of them do a really great job because they coach, they know their place, they're helping their patient. But when they start answering questions or taking over for the patient, then that kind of, as a provider, that throws off, even not just the doula, anybody in the room that's answering for my patient instead of them.
Right.
It's a problem.
Gotcha.
Yeah.
Gotcha. Yeah. Especially given, you know, the information that we're bringing forth today is super important that the patient be their own advocate and really, you know, talk about what is going, because only they know what they feel inside in their body, you know, what's going on with that. But so thank you for that information, because I know that that's an area that a lot of Black women are starting to move into, you know, wanting to have a doula throughout pregnancy. Right now I have a niece who's pregnant. And so her thing is, you know, she's visited a couple doctors and she wasn't feeling them. And it's like, well, I need to find somebody that's going to be there to kind of really support me since I have to go see a doctor. I want to take a doula because, you know, her thing was she feels like the doula would really be able to, you know, kind of know what questions to ask. Because it's her first baby, so she's really not sure what questions should I ask her.
Right.
Well, should I say something to this or should I not? Or, you know, how much time should I be in the room with the doctor? You know, is that doctor really going to take the time out to, you know, spend with me if I have questions? So I think for her, that was kind of like a comfort thing. But again, like I said, that's an area that a lot of Black women are moving into, is wanting to have doulas, because like y'all said, a lot of our women don't really trust the healthcare system. And so I just wanted to make sure that I asked that question so that they will that people who are viewing this, if they pass this information on to somebody, they will know like what the difference is between the two.
Well, I think a doula is great as a person there for support, because I tell people all the time, not even just in OB, take somebody with you when you go to the doctor.
Gotcha.
Now with COVID going on, there's a lot of people that don't allow, but before this, because especially if you're elderly, because you may not know what questions to ask. So take someone that can ask questions, write down questions before you go. And it's always better to have 2 ears, because 9 times out of 10, by the time you walk out, you will have forgotten something that the provider has told you. So at least if you have a second set of ears with you, then you'll know what's going on. That helps.
Got you. Wow. This has been like a really, really good episode. I'm like learning so much, and I'm hoping that everybody else is learning a lot as well. So let's get into just really quickly, just some of the disparities that you all have experienced or seen within your industry. What are some of the racial disparities that you've seen? And then I want to get into what questions should patients come armed with to ask their doctors. And kind of like, you know, when you go to a doctor, it should really kind of be like an interview, because you want to know if the person who's going to be treating you, you feel comfortable. Do I feel comfortable with this person? Do I feel confident that they're going to hear me if I tell them that, you know, XYZ is going on with my body? And, you know, are you going to, you know, be engaged enough with me for me to have that level of comfort? So I want people to know what racial disparities are existent within this industry in terms of labor, delivery, and even, this is the other thing. I didn't even know that a lot of women pass away within the first year of pregnancy, of postpartum delivery.
Yeah, because of just, you know, postpartum complications. And I always tell my patients, you know, you're really pregnant, not even just the 9 months, but you got to tack on 12 more weeks after that, because things can still happen within that 12-week postpartum period. And I've admitted multiple patients with hypertensive issues, diabetes issues, when they were like 6, 7, 8 weeks after having their baby. So
Yeah.
it's very important to not just, oh, okay, I've had my baby, I can just go back to living my best life. And
Yeah.
yes, live your life, but still be very aware of, your health conditions, and be very aware of what medications you need to be on. Be very aware of your diet. And, I encourage my patients, if I can, I try to order them blood pressure cuffs so they can take their blood pressures at home. I order them glucometers so they can take their blood sugars at home.
Okay.
And in our clinic with, Ms. Jaida, she'll tell you, we have our patients write down all their blood sugars for the whole week. And then we have them come back every week. Like, how are your blood sugars this week? And if they're not that great, all right, let's go up on your insulin, or let's tack on some metformin. Or how are your blood pressures this week? Okay, they're not that great. Let's add on this medication, that medication. Oh, I'm sending you to the hospital. You need to be delivered today. It's a constellation of things that we really try to do. So then not only are people equipped with what they to do at home on how to take care of themselves, but they also have the knowledge of, okay, this is considered bad. So this is when I know to call my doctor. I always give them strict precautions. These are the warning signs that I want you to be aware of. These are the numbers I want you to be scared of. And if you experience any of that, you need to call our hospital, or you need to go to your nearest hospital.
Wow. That blew my mind. Like, I know back, old school Jaida in our community, honey, when you had a baby, you was in the house for 8 weeks.
There you go.
I mean, that's period. Listen, old people was not playing it. You're not gonna be outside with that baby. You're gonna be at home. The only time you leave the house is you going to the doctor.
That's it.
Other than that, you're at home tending to your body, making sure you get yourself back together. And so I'm wondering, like, I used to think that was kind of like a superstitious thing, but it's something that I continue to do, and I would encourage my daughters to do. But I'm wondering if there's any merit to that.
Well, it's definitely a cultural thing.
Okay.
But I do think, when I think back and talk to my aunts, and when my mom was alive, I would talk to her about certain things. There's always reason for why they put things together, why they told us things. Just like we said at the beginning, when they talked about pregnancy is the closest to death a woman will ever be without dying. So there are reasons that they come up with these things. Like, I was in Georgia and I was pregnant, and I reached in the cabinet to get a cup, and my aunt almost died. She probably tried to break me. Don't you reach over your head? I was like,
that's the kind of stuff,
And at this point, I was working as a midwife. So of course I put a lot of things that we have come up with culturally as old wives' tales, but there are reasons behind whatever we have come up with. Something has happened to them at some point. And I asked her, I said, well, what will that do? She said, it'll make the baby wrap his cord around his neck.
Wow.
This is what she said. Now, there's no medical there's no medical research behind that. But when I thought about it, it made sense. I guess if I stretch more, that gives the baby more room. I don't know. But I didn't question anymore. I just didn't reach in the cabinet. There are things that have happened throughout life that have caused them to come up with these reasons. And I think that staying in the house at least 6 weeks, well, mine was 6 weeks, and my mom was right there to make sure. There are reasons behind that. You end up, and there are, and I tell my patients, I tell them my stories of how I had to stay in the house, and hopefully they listen. But I also tell them, when they come in and say, well, I just started all of a sudden bleeding all over again. I said, well, were you up and about doing? I went grocery shopping. You need to
too fast.
You're doing too much. Too much.
Give your body time. Like, I don't think that we really realize, because it's such a miracle how the whole pregnancy and delivery and birthing process even happens. It's just so amazing. But I don't really think that we realize the changes that our bodies go through, just readjusting and trying to, conform itself back to somewhat of a normal state. And so when I kind of was doing this research and looking at stuff, I'm like, well, dog, our bodies really do go through a lot of stuff. And so just hearing, that women, even post delivery, their high rates of death, even in that 12 months, I was just like, wow.
Mm-hmm.
It
Yeah.
was it was kind of, it set me back a little bit because I didn't think about it. And then I thought about, the things that old people used to say, and
Mm-hmm.
that's where it came back to me. Um, so can you just really quickly, I know we only have like a few minutes left. I don't want to keep you guys too late. I know y'all worked all day today. Some of the racial disparities that you see that exist in the industry that Black women should be cognizant of, and how they can kind of work around that. Work through those disparities, especially. And I know one of them is, like you said, doctors not listening,
Mm-hmm.
right?
Mm-hmm.
When a patient says, I feel strange, I feel like something is going on, and the doctor's not listening, maybe let's talk about some things that they can do to counteract those reactions.
I would say, if you have a physician that's not willing to listen to you, go somewhere else.
Yep.
Go somewhere else, because you are not obligated to only see that one physician. God made many physicians for a reason, and you need to feel heard, you need to feel understood, and you need to feel safe and comfortable. And there's nothing more warming to any patient is when they feel safe with you. When they say, you know what, I trust you with my life and my baby's life.
Mm-hmm.
And so if you have someone who's just like brushing you off, not really willing to kind of give you the benefit of the doubt and poke into what's bothering you, I would seek another opinion. Ask for your medical records and go to another physician and then see what they can do to help you. I don't think there's anything wrong with that.
I think you said it best earlier when you said it's like an interview, and it should be. And if the process goes correctly, you're talking about getting preventative care. So you're going to whoever your primary care physician is, making sure your nutrition is where it needs to be, even before you get pregnant. So during that time, there are ways to interview, talk to, look up, research different OBs before you even get to the point of becoming pregnant. And then decide and go there. And that way you can, talk with them. And like Dr. Orizu said, decide on your own if this is somebody who you want to help you with your pregnancy and your delivery.
Right.
Because again, it is an interview and you choose us.
Right.
Yep.
I love it. And I think, like you said, when you talk about just annual checkups, when you're going to an OBGYN, you make that connection with them. If you feel like at the time that you're going to your annual womanly checkup, if that doctor doesn't seem to be one that takes the time out to talk to you, and you need to be, maybe those are red flags that need to signal when I'm getting ready to, now I'm pregnant and I got a whole person growing inside of my body, like I probably need to reconsider who I'm seeing, to see maybe that's just not the right fit. You know what I'm saying? So I love that. I love the fact that you guys touched on that. Okay, so I do have more questions, but I'm not going to hold you all any longer. We've already been on here for 40, like I think our statement has already been 40 minutes.
Oh,
I mean, it has already been like 40 minutes, but oh my gosh, like if you guys are in the St. Petersburg area, y'all need, if you're pregnant, even if you're not pregnant and you're just a female, Black female, y'all need to consider going and seeing Nurse Jaida and Dr. Orizu over, and you're at Bayfront.
Yes, we're at Bayfront.
Okay, yes, Bayfront. That's like one of the first hospitals in St. Pete, y'all. So
Yeah.
it's a staple in the community. So y'all need to make sure y'all go over and check them out. We are hosting, and I don't want to put y'all on the spot, but we have a Harlem Nights extravaganza coming up October 14th through the 16th. That Saturday we're doing a vendor festival, and we would like to do like a nurse's tent for people to come and get, blood pressure checks, things of that nature. And I would like to invite you all to be a part of that. It's something that it's a nonprofit situation, but we're doing the vendor festival to really celebrate Black businesses, support Black businesses, bring awareness to Black brands. So it's going to be a nice event. We're going to have a kids zone out there. It's a STEAM kids zone. science, technology, engineering, arts, math. We're going to have food trucks, vendors, entertainment. It's going to be a really nice event. And I would love it if you guys would consider. I'm going to reach back out to you after this to see if you would
Okay.
consider being a part and just being at the tent. And I don't know if you all are able to, or if you have to go through Bayfront or your employer to get clearance for that. But just to be there, maybe we have some young women might be pregnant, we don't know, or maybe have never even been to the doctor,
Right.
but might need a blood pressure check, or just to talk to somebody. We are going to have a tent out there for women's cancer awareness, so talking about female cancer symptoms, just things that women need to look out for, because we don't, especially in the Black community, we don't really pay attention a lot to our own bodies, because we give so much of ourselves, right, taking care of everybody else. We forget to take a look at our own selves and to put ourselves in a position of, we need someone to check us out and make sure we're okay. So I would love to invite you guys out to be a part of that. I will provide y'all with more information. But as we're closing, what information would y'all like to leave the people with? What would y'all like to leave the viewers with?
Well, number one, Black women are beautiful, always will, always have been. But on a serious note, please take your health seriously, and just know that you have a support system. You're not alone in this world. With COVID and everything that's been going on, a lot of people have been feeling super isolated. But I try to make my patients feel like they have someone else who is there to help walk them through the fire of whatever they're going through. So keep fighting for what you believe in. Fight for a good doctor who's willing to listen to you. Fight for a good nurse, midwife who's willing to listen to you. And at the end of the day, our goal is just to continue to thrive and do well in this life that God gave us.
Yes, I love it, Dr. Orizu.
Yes.
Nurse Jaida.
I will echo what she said, that Black women, Black people are absolutely beautiful, but we have to make sure that we remain that way inside as well as out. And one of the ways is, again, preventative care, making sure that you're going to the doctor regularly, just for your regular checkups. And these things will help you do preventative care to make sure that you don't get to the point of needing medication for high blood pressure or for diabetes, or if you happen to be diagnosed with something, then you get the care necessary so it doesn't go on further. So that is our big thing. And education at all points, at all costs. If Black, white, green, brown, whatever color your provider is, ask questions, learn about yourself, learn about your body, learn about what's going on. Don't be afraid. And one big thing that we need to delve into as Black people and understand more about is mental health problems, and understanding that those things do exist, especially with COVID right now. More aware and pay attention, and not so argumentative and about those kind of things, and know that mental health problems affect every age, every color, everyone.
Yeah.
So just love yourself so much that you go take care of yourself.
Exactly. I agree 100%. OMG. So I would like to thank you both for just coming on the platform. I hope that you both enjoyed yourself. Dr. Orizu, thank you for coming out of surgery and joining us. I'm so glad that you did. Nurse Jaida, thank you so much. This has been like, a couple of months in the making. We've been working on this for a few months. So I'm actually glad that it worked out. Listen, I thank you. This was information that we definitely need to share and to spread far and wide for our women, our community, to understand the importance of, like you said, mental health. And yes, you're beautiful on the outside, but be beautiful on the inside too. Making sure that we're taking care of ourselves, just health wise. So thank you so much for joining us this evening. Yay! I will definitely be in touch with you both. You have a blessed and wonderful evening, both of you, and enjoy the rest of your week. And I'll be in touch soon.
All right. Take care.
Thank you.
Good night. Wow, that was really good. Listen, if you guys missed it, you're just tuning in. You guys gonna have to go back and start from the beginning and watch it. Listen, this show was absolutely fantastic. Very good information. While the conversation was very, intense in terms of the topic that we were discussing, we got a chance to really laugh and have some light moments here. But if you're tuning in, please make sure that you share this episode of TeeShirtz and Tea Tuesdays with all of the women and females that you know, Black women and females that you know. Make sure that they hear this, and if they have questions, to make sure that they are going to their healthcare providers. And if they're not feeling comfortable with the doctor that you've chosen, just like Dr. Orizu said, you can always make a change. You are not married to the doctor. Listen, you can make a change. So please, like I said, like, share, subscribe if you're on YouTube, follow if you're on Facebook and Instagram. And with that being said, don't forget to tune in to Bimp on the Spot with Taz this coming Thursday evening at 7:30 p.m. with Q&E podcast Quincy Hicks and Edgar Martin Jr. as Taz interviews them, exclusive interview. So make sure you tune in. With that being said, guys, we will see you. This concludes season 6 of TeeShirtz and Tea Tuesdays. We will see you back here for season 7, not too late, not too far from this date. And don't forget, make sure that you follow, because we will have some special episodes that we'll be bringing to you guys with special guests that'll be participating in Harlem Nights. You guys won't know if you're not subscribed and if you don't have that notification bell on. Anyways, guys, thank you so much for tuning in to season 6, TeeShirtz and Tea Tuesdays. We hope to see you soon. God bless you and have a wonderful evening. Good night, everybody.